So that's just one way of adjusting the low back. That same way, using the drop piece like I demonstrated, can also be used further up in the spine as well. Then there's another way that I'll show you in another clip. The next thing that I do in my assessment of a patient is I will go on up to the lumbar spine. And the lumbar is the bottom 5 vertebrae in the spine before you get to the pelvis. Now what I do in my assessment is I first feel for heat, okay, because we talked earlier about how subluxation has inflammation and swelling involved. So I'll feel for any kind of heat, okay. When I find an area that's warm, then I'll make a note of that. And I'll feel for any kind of muscle spasms, okay. And again, make notes of those as well. And then I will also come in here and be able to feel how each vertebra is moving in the spine, okay? And then once I find it, I can compare all of what I find with what I see on any x-rays that I may have taken. Again, I put all of this stuff together. I like to consider it, like I said before, pieces of the puzzle, okay? And then when I find one, okay, again, I can, even in the lumbar spine, I can use this same drop piece if I want, okay? I can adjust it up, place my hands onto the spine, and then place that pressure downward so the drop piece falls back to its original position and makes the adjustment through a series of those.